Um, Today's talk uh, goes over the 2019 prize in economic sciences. And it was awarded to 3 investigators for their experimental approach to alleviating global poverty. So our speaker today is Hector Sandoval, who's in the Department of Economics. Dr. Sandoval received his PhD in 2015 from the University of Wisconsin in Madison. Before working on his PhD, he worked in the Poverty Analysis Division of the National Council for the Evaluation of Social Development Policy in Mexico. And at the same time, he served as a consultant to the World Bank and the UN Human Development Office in Mexico. He does applied microeconomic research, focusing on social interactions in education program evaluation of development economics. So he's going to explain to us the experimental approach to alleviating global poverty. Welcome, Dr. Sandoval. We look forward to your presentation.
Thank you so much for the invitation. So I'm gonna share my screen. So is it working correctly? Yeah, can you see the slides?
Yes, it looks great.
Oh, okay, yeah, that's great then. Then let me start again. Thank you so much for the invitation. I'm Hector Sandoval. So I'm an assistant professor at the Department of Economics, but I also work at the Bureau of Economic and Business Research, BEBR, both at the University of Florida. So let's start the talk. So although it is not one of the original Nobel Prizes established by Alfred Nobel in 1895, the Nobel Memorial Prize in Economics was actually established in 1968 by a donation from the Sweden's central bank. And that's this, I'm gonna mispronounce this, but it's gonna be the Sveriges Riksbank Prize in Economics. So that's why we have this name. And then in 2019, it was awarded to Abhijit Banerjee, Esther Duflo, and Michael Kremer for their experimental approach to alleviating global poverty. So let me talk a little bit about each of the winners of the prize. The first one is Abhijit Banerjee. He was born in India in 1961. And he received his PhD from Harvard University in 1988. And he's currently a professor of economics at the MIT. Banerjee, he's also a co-founder of the Abdul Latif Jameel Poverty Action Lab, JPAL, with economist Esther Duflo, which is the other who won the prize with him, and also with another scholar, which is Sendil Mullanetal. So JPAL actually play a very important role in the Nobel. So that's why I'm bringing this up. So JPAL is a global research center working to reduce poverty by ensuring that policy is informed by scientific evidence. And I will talk a little more about this Poverty Action Lab. Banerjee, he was elected a fellow of the American Academy of Arts and Science, as well as the Econometric Society. He's also a fellow of Guggenheim and Alfred P. Sloan Fellow. But he's the recipient of the first Infosys Prize in the category of social science. Something on his personal note, his father also earned a PhD in economics from the London School of Economics. And in 2015, he married his co-authors, the co-research Esther Duflo, and they have 2 children. So let's talk about the next winner, the next Nobel laureate. Duflo, first of all, she's the youngest person at age 46, and it's also the second woman to win the Nobel Prize in economics. She was born in France in 1972 and received her PhD from MIT in 1999. And she's currently a professor in the Department of Economics at the MIT. As I mentioned before, she's a co-founder of the Poverty Action Lab in 2003. She has received numerous awards, for example, the Princess of Asturias Award of Social Science and many others, but she has also received one of the most prestigious awards in economics, which is the John Bates Clark Medal in 2010. This medal is awarded by the American Economic Association to that economist under the age of 40 who have made a significant contribution to economic thought and knowledge. And it's actually widely regarded as one of the field's most prestigious awards, and it's second only to the Nobel Prize. So she has these two awards. Finally, we have Michael Kremer. He's an American economist who was born in 1964, and he received his PhD from Harvard University in 1992. And since the fall of 2020, he is the university professor and public policy at the University of Chicago. Before, he was a professor in the Department of Economics at Harvard University. That's where he was when the Nobel Prize was awarded. At Chicago, he is the founding director of the Development Innovation Lab at the Baker-Friedman Institute for Economics. He is research associate of the National Bureau of Economics Research. And he was elected a fellow of the American Academy of Arts and Science and received the MacArthur Fellowship, among many other awards and prizes. So these are our three winners. So let's now talk about more why they win this award. But first, let's start by providing some context to the Nobel Prize. So over the last 20 years, people's living standards have actually improved a lot. But despite the progress, one of the most urgent issues is the reduction of global poverty. In fact, the United Nations set the goal of eradicating poverty by 2030. And as the figure that I have here shows, actually the world was off track to end poverty by 2030, although there's been a substantial decrease in poverty. So now the 2019, so the question is how to effectively reduce global poverty. And the 2019 prize in economic science reward the experimental approach to combat poverty. So the research carried out by the laureates introduced a new approach to obtaining reliable answers about the best way to fight global poverty, and it also transformed the practice of development economics. And at the end, their work has actually improved and increased our understanding of poverty in the developing world. So let me provide you a little more background on why still global poverty is one of the biggest challenge. In 2015, there was a set of goals by the United Nations. They are known as the Sustainable Development Goals, and they are intended to be achieved by the year 2030. There are 17 in total, 17 different goals, but the very first one is really to end poverty in all of its forms. So that's the first goal, to end poverty by 2030. So poverty reduction is still part of the global agenda, and that's why it's still very important, all the contributions done by the Nobel laureates. In the figure, I have some forecasts done by the United Nations. They show that due to the COVID-19, actually the poverty, instead of decreasing, it's forecast to go up. So that means that still poverty is going to be a very relevant policy issue in the following years. So the research carried out by the laureates introduced a new approach, a new experimental approach to obtain reliable answers about what is the best way to fight global poverty. but their approach relies in two very, very simple and powerful ideas. The first one is that empirical micro-level studies, which are guided by economic theory, can actually provide some crucial insight into how to design policies for combat poverty. In economics, we typically distinguish between microeconomics and macroeconomics. Microeconomics is really the study of individuals and business decision. Macroeconomics looks more at the decisions done by countries and governments, and typically a lot of the research done in terms of development was at the macroeconomic level, was about economic growth, and those were some of the first theories behind economic development. But now this new approach actually focus more on the individuals at the micro level, and that actually turned out to have an important impact in kind of how outcomes and how growth can turn out to be. So that's one of the ideas behind the approach. The other one, and that's just that the best way to provide some causal inference to really assess what is the causal effect of some poverty, of some measure, some program, or some intervention is really to conduct a randomized controlled trial. So this is the two things: study individuals and do experiments. So this is the combination of these two ideas that is behind this Nobel Prize. So this modern approach focus now into identifying workable policies for which we can actually measure what is the causal impact of them. So it's really, we're looking more into, instead of having some big pictures, big policies, it's just really more focused policies that are able to implement, that actually will have some impact, and we can measure what is the impact of those policies. And so the systematic application of these two ideas in the last 20 years actually transformed what we call the research in development economics. And as a result, now we have a vast result of very specific mechanisms behind poverty and specific interventions to combat poverty. So this is the contribution. It's not only thinking about poverty, but it's really designing policies that work. And again, that work is done through randomized experiments. So let me talk more in concrete about the contributions more broadly. So the transformation of the field involved important contributions by many other researchers, many other scholars, but there are three contributions that stands out by the Nobel laureates, and this is actually some of the reasons cited to award them the Nobel Prize. So the first contribution is that in the mid-1990s, Michael Kremer and co-authors, they launched a set of randomized controlled trials on schooling in Kenya. And the essence of his approach was really to breaking down the question of how to boost human capital accumulation into smaller, more manageable topics, each of which we could be studied by doing a randomized controlled trial. So he's breaking the question. We want to boost human capital accumulation, but instead of thinking of the big question, you're going to see that he breaks this question into pieces that you can actually measure and capture, and some very concrete policies that you can implement. So this is the starting point of the new approach in development economics. Very after Michael Kremer, Banerjee and Duflo, and also many other co-authors, they broadened the set of educational topics, and they launched field experiments on many other subjects, and I'm going to show you some of the experiments that they carried. So overall, these studies play a key role in expanding the new approach, and they actually span to all the branches in development economics, like education, health, credit, and things like that. And again, I'm going to mention some of them in the following slides. So in these pictures, I'm showing this is the day they received the award. So this is the ceremony of the Nobel Prize in this picture. So the second important contribution, this was actually carried out by Banerjee and Duflo. And they actually, what they did is they actually make the case for the microeconomic approach to help understand aspects of the development problem. I mentioned before the development problem was we want the countries to grow, we want their economies to grow so that this will benefit all the people. And that was the approach, economic growth, and what was the policies that will make this growth happen. But then they make the case that actually it's better to focus at the individual level, at the microeconomic level. So they make the case. And there was one particular paper that was published in 2005 with a very important insight that they found. That actually links the microeconomic development issue to low aggregate per capita income levels in developing countries. So the main starting point is some empirical observation. So this is the key contribution. They actually see that low and middle income countries or economies, they have actually large heterogeneities in the rates of return to some of the factors of production within the countries. This another way to say this is actually that firms and individuals in developing countries, some of them will use the latest technology, but others in the same country, in the same industry, are going to use outdated methods of production. So this is actually a huge disparity within the countries. And if we look into high-income countries, this difference are actually much more smaller. So there is less heterogeneity in high-income countries, while in low and middle-income countries, there is huge disparity. And this disparity, that what we call some kind of misallocation, this may be severe enough to help explain the large productivity gaps between low and high-income countries. So we have these low and middle-income countries with huge disparities, but overall, that disparity can also explain the gap between low and middle and high income countries. And that was what was kind of explained in this paper published in 2005. And so now the question is why some firms and individuals do not take advantage of the best available technologies or opportunities. So the Banerjee and Duflo, they argue that this misallocation can actually be traced back to market imperfections and government failures. For example, the government having some failures in implementing, for example, in providing education, in providing healthcare, and things like that. So this is some of the problems that they were able to trace down, that this misallocation. And so at the end, it translates into understanding why some countries are poor is really trying to identify sources of inefficiencies and also the policies to address them. So in 2011, they published, Banerjee and Duflo, they published the book that I have here, Poor Economics, a Radical Rethinking of the Way to Fight Global Poverty. And they actually, in this book, is based on our results from a large set of these experiments. And this is actually studies on what is the causes of poverty. And they actually provide lessons and they actually push for a science-based approach to improving the health, schooling, and incomes of the poor. So that's kind of the second very important contribution done by the laureates. And finally, the third contribution, it's actually more related to the design of experiments. So they actually design new experimental methods, but one of the issues with this experimental method is normally how can we generalize the results, how we actually extrapolate the results from some experiment to the general population, and that's what we call issues of external validity. I will show later that the laureates actually work also in addressing this key challenge of generalizing results from a specific experiments. And also a very important piece within this contribution was played by the Poverty Action Lab at the MIT, which is called JPAL, which again was founded by Banerjee and Duflo together with another economist, Sendil Mullainathan. And the goal of this, the goal was really to provide new approaches to challenge and to understand global poverty. So JPAL promotes research built on randomized controlled trials in many countries and promotes the acceptance of results from such trials in economic policy community. Today, the core staff includes more than 400 professionals, in economists, researchers, staff, and that's actually located in 7 offices that are around the world. So this is the part of the impact is this Banerjee and Duflo, they founded this, which is actually pushing to make these experiments, but not only to make experiments to understand the causes of poverty, but it also pushing for governments and for people who are policymakers and will take the decisions really to use this information to really design programs that will really help reduce poverty. So these are the 3 main contributions by the Nobel laureates, and later on I will provide much more specific examples of them. But now I mentioned one part was the focus on the microeconomic level, but I also mentioned that the other very important part is this experimental approach. And so an important boost for the transformation of development economics research, and not only development, I will say now that a lot of the empirical research done in economics now in other fields are actually guided by this experimental approach in the idea that we want to estimate causal relationships. So there was a boom in that we want really to estimate causal relationships. And so the problem is that estimating causal relationship is something like answering questions of how will some individual exposed to some program have fared in the absence of the program. And the problem is that at any given point in time, an individual is either exposed to the program or not. And that's what we call the fundamental problem of causal inference. You cannot really observe the individual when you receive some programs, some benefits, and the state when he doesn't have it. So you cannot really observe these 2 at the same time. And so that's the problem. That's the challenging in making causal inference. But the problem, but it's possible, and this is being shown by researchers, that it's possible to estimate the average impact of the program on a group of individuals by comparing them to a very similar group of individuals who were not exposed to the program. And so to do so, it actually requires to build a credible comparison group or a control group. And now the question is how to find a valid comparison group, how we build this comparison group, how we find this one. Well, one example is if you compare individuals that are exposed to some programs with a group consisting of people that are not exposed to the program, that comparison will not really reflect the effect of the program. Within this comparison, you will see what we call the effect of the program, plus some term that we call selection bias. And this is just to say that these 2 individuals, in the absence of the program, they are different. They're already different. Their choices, their behavior is different. So once you apply the treatment or some program, you are not really, there is already some bias there that you introduce, and that's what we call this selection bias. So it's some kind of error when the researcher chooses who is included in the study. But there is a way to kind of solve this issue, and one method to solve the selection problem and get what we call unbiased estimates of causal effects is actually to randomly assign individuals, and that's just really to make a randomized control trial. And that's kind of, in economics, there was people doing empirical work since many years, but then it became this push about trying to really make causal estimate, really to estimate the causal effect of things. And so this was a revolution within the empirical field. And then and that's why people start to take on these randomized controlled trials, and people in development, that's kind of their tool, one of the main tools they use now in doing their research. So let me talk a little more about these randomized experiments. So when they are correctly design and implement, this actually a randomized control trial will allow the researchers to estimate the causal impact of a program or an intervention. And so a randomized control trial randomly divides experimental targets, and these can be students, schools, localities, even household, even, sometimes some maybe geographic areas, and they will randomly divide into what we call a treatment and a control group. And then they are going to estimate the causal effect of the treatment by comparing the outcomes in these two different groups, one with the treatment, but one with the control. But the main point is that by doing randomly, you are actually creating a situation where the only difference across these two groups, so these two groups are going to be very similar on average, they're going to be very similar, but the only difference is that one of them is exposed to some treatment, and so that's how we're actually removing this selection bias. So there is the only difference is the exposure to the treatment. So that means when you compare the outcomes, you can really assess what is the causal effect of the treatment. And this is really the main approach, the main empirical approach behind all the results that I'm going to show you soon. So of course, these randomized control trials, they have a long history in science. They are not new. Actually, a century ago, there was actually agricultural researchers. They were the one who pioneered their approach in doing crop studies. And then later in the post-war era, these randomized control trials, they became closely associated with clinical trials and field trials in medicine. In economics, there is some important randomized control trials, some experiments that actually predate the explosion of experimental work done in development economics. Some of them is the Perry preschool project in the 60s. Another one is the negative income tax experiment, also in the late 60s, 70s, and early 80s. And the last one, also very famous, is the Rand Health Insurance Experiment that started in 1974. This one, the last one, was actually an experiment study of healthcare cost, utilization, and outcomes in the US. So the study was designed, assigned people randomly to different kinds of health plans and aimed really to learn how much more medical care will people use if it's provided for free. And also what is the consequences for their health. So that was one of the first experiments done. Just to let you know, the results of that experiment show that the modest cost sharing reduces the use of health services, and there is actually some very negligible effects on health. So it's really, the results didn't really show a big effect. Then later on, there was a rapid growth. That's when in the 90s, that's when this experimental approach boomed. And one was these studies done in Kenya by Michael Kremer, and that's why he won the Nobel Prize. Another very important set of experiments were carried out in Mexico, and it's called the Progresa experiment that started in 1997. This program was a conditional cash transfer program that give money to poor families, but the condition was, I will give money, but then you will send your kids to school and we're going to verify the attendance. So that was the condition. So it was a conditional cash transfer program for poor people living in rural Mexico. And so that's kind of like when all these experimental approaches started really to boom and started really to be in the minds of all the empirical researchers. So the main method used to estimate causal effects is not new. But the application of these randomized controlled trials in economics, especially in development economics, really expands its use. That's why I will say in social science, it became even more popular or way to do research. So there is so I think normally when we think about these randomized controlled trials, we think about like what people do in these clinical trials, in medicine. But the designs of field experiments, which is more what we call, because this is kind of really going into some rural areas, some places, and like going into the field. The design of these field experiments are actually different from some designs that are in more controlled settings. One fundamental insight from economics is that most outcomes that we want to influence, they are actually a result of choices made by individuals. So individuals are really taking the choice. Why should I do this? Why I should do that? So this is actually a choice, and that comes, this is a behavioral response. And so there is the need to really understand what is the causal pathway through which these changes in what economists call the incentives, the constraints, and also the information influence the outcomes of interest. So there is incentives. It can be economic incentives. It can be social incentives. They influence how you make decisions. And so the idea is we want to understand these kind of incentives and this constraint and how this plays an important role in the outcomes that we are observing. So the point is that to influence the outcome, we really need to understand what is the choices and mechanisms behind. That is what we call the causal pathway. So for example, one example, despite the established medical knowledge on how to stop malaria and many other deadly diseases, today, there is still millions of children in low-income countries that die from all of these very preventable diseases. And so today's discussion about reducing child mortality in low-income countries, it actually revolves around human behavior. For example, why is it that a proven and inexpensive, really some of these vaccines for malaria are very inexpensive, and the quality of care is not provided in these areas, or is not demanded? It's also why providers in the service delivery chain not show up at work. Some of them is there is just people don't really perform. So that's actually these kind of questions are at the heart of the experimental approach adopted by development economy. So it's really trying to understand what is in the human behavior that is producing these outcomes. Also, very important, the randomized controlled trials, although they are kind of a little difference than what these clinical medical trials are. There is benefits. There is actually a huge amount of benefits of doing these randomized controlled trials. They are actually unique in giving researchers the complete control, not only of who received the treatment, which is what we call the assignment mechanism, but also over the treatment itself. So this design flexibility has a number of advantages. For example, the researcher can manipulate the treatment of interest to create events that have not yet been observed. So before, research, empirical research in economics was based on what we observe in the data we collect. So we were making observation and inference based on things that like occur like some time ago. And you are actually, maybe there is some situation that never happened before, so we don't know, or we don't have information or data to analyze to kind of know what will happen. But that's a very different issue with these randomized controlled trials, because you can actually manipulate these treatments. So that means that you can test new policies or interventions that you might think it will be effective. And so this is some of the benefits of this new approach. So let me now give you more concrete results. So this is really the evidence on how to fight poverty in developing countries. Again, this is all this set of policies that they have tested through all these experiments, and at the end they have built the knowledge into tell, okay, we know this works, this doesn't work. And so this is really very, very practical approach. So let me start first by talking about education. So over the last 10, 20 years, many developing countries actually expand primary school access. And one of the reasons was that these Millennium Development Goals actually call for the achieving of universal primary education. And so because of that, enrollment increase in a lot of these developing countries, school enrollment increase. But the problem was that there was an increase in enrollment, but this doesn't really translate into improved learning outcomes for all the students. And this is especially true if the quality of education is poor. So Kremer and co-authors, Michael Kremer, this is the starting point of the new modern experimental approach. They launched a series of field experiments in collaboration with a non-governmental organization, NGO, in Western Kenya in the mid-1990s. And they actually want to study how the supply and demand of different factors interact to determine educational outcomes. For example, and something people at that time were always thinking, poor education, maybe it's just due because of lack of proper school materials, right? Which are often undersupply in the poorer areas and rural areas and on all these developing countries. So at that time, there was some kind of widespread belief that if you provide school materials, then that will really improve educational outcomes in rural areas, especially in developing countries. But at that time, there was really little evidence to confirm this. I mean, empirical evidence to really tell that this approach works. So what Kremer and co-authors did, they actually realized a set of different experiments, actually a total of 5 experiments to test something very more manageable, something more concrete. So the first experiment, it was actually trying to assess what is the impact of just additional inputs. In that case was just what is it if we just provide some textbooks, and that started in 1996. And I'm gonna give you some of the findings. Another important experiment was into, well, what if we give these flip charts to schools? Some of these flip charts are actually rare in schools in these areas in Kenya, in rural Kenya. And so that's kind of like, and also the textbooks are kind of rare. So that's kind of the thought is, if we provide these supplies, well, we shall see an improvement in the learning, in the student outcomes. Also, something they explored were also related to health, the effect of some health interventions. And one of them was some deworming intervention, which is you give some vaccine to kill some worms on the children. And that actually started in 1998. Another experiment just tested school meals, and this started in 2000. And by experiment, I'm kind of what I want to mean is that they actually make a randomized control trial. So for example, in the case of the school meals, what they actually did is there was one NGO that was providing school breakfast. And so in 25 randomly selected preschools were actually assigned to receive the school breakfast, and then the other one didn't receive anything, and that's the control group. So they really create these experiments, and of course you want to administer the experiment and be sure that, I mean, it's carried out properly. But this is how they are getting their results, and they are testing all these ideas. It's just, instead of, the goal is we want to boost human capital accumulation. We want to increase education, the human capital. But then now the approach is like, okay, let's see whether the textbooks, if we add more textbooks to these schools, will have some effect. Whether these flip charts, whether we provide some vaccination program, whether we have school meals and so on. They also provide financial incentives to teachers. I mean, kind of really try the idea to see if, like, okay, if the students are doing well in the test scores, then I'm gonna kind of reward the teacher. So they actually try all these things. And some of the findings were actually very surprising at the time. So what they really found was that more textbooks per students did not improve the average test score. It actually improved just for what we call the high ability students. They were the only ones who really benefit from this. And one of the reasons it's because there was this influx of new children, and many of them, I mean, their parents never had any education, so they were really kind of disadvantaged. And that's why even if you give them the textbook, they were not really able to increase or improve their learning. The same happened with these flip charts. They had no effect on student learning in this context. They also showed that these health interventions, providing this vaccination program, actually reduce school absenteeism, but didn't really translate into better test scores. And finally, also this effect of providing teachers with financial incentives actually kind of the incentive programs can actually, lead the teachers to either increase their effort, so they will give more effort and stimulate the students. But it's also true that they can actually just teach to the test. So instead of trying you to learn, I'm just trying you to how to solve the test. And they actually show that the latter effect dominated. So this is actually very surprising results. And at the end, it challenged the conceptions, the preconceptions that we have of what is the things that can work and how they can work. So that's kind of why Michael Kremer won the Nobel Prize, just like start things. And although the results were surprising, the studies really illustrate the power and also the feasibility of really making these field experiments. So later on, so the findings on these first field experiments in Kenya, they actually provide a starting point for randomized controlled trials in India, done by Banerjee and Duflo, which started in 2000. So they were working with an NGO in government schools in India. And they actually designed two interventions targeting learning by weaker students. So the first one was a remedial education program, which is called in Indian is the Balsaki program. And the idea of this program was really to provide remedial education. So there was a tutor, which was usually a young woman recruited from the local community and was just paid a fraction of the cost of a civil service teacher. And this woman will work with the children who were identified as falling behind their peers. And so this tutor will meet with a group of students, 15 to 20 students. And this is a picture, this is how the program was implemented. And so these children who were taken out of the regular classroom, they were actually going to a separate classroom for 2 hours every day. And this was really just remedial education. So they actually create these interventions. So working with this NGO in India, Banerjee and Duflo and co-authors, they test this. And they also tested a computer-assisted learning program where children play games with some math puzzles and share computer for 2 hours a week. So their results actually show that the effects of both interventions, they have very positive effects in terms of learning. So these were very concrete ideas, very concrete policies that actually seems they were able to evaluate and get concrete results. And later on, I will mention that especially this remedial education program was something that was scaled up by the government. Another very important experiment related to education is related to class size and tracking. So normally a common response to overcrowded classroom is to add more teachers. And so the idea is just simple. You have a very big classroom, you hire another teacher, so you split the classroom in two. And so lowering the student-teacher ratio will increase the amount of time a teacher can spend with a student. And so the idea is that if the class size is small, this will have a positive effect on the learning. So that was kind of like a part of the research. We want to understand whether this class size has some effect. But the other one is, well, once you decide to split the classroom, there is two ways to do that. One is, should I track the students, which means I'm going to put all this, let's say I have one classroom and I'm going to split it in half. So I can do that in two ways. One is I can track the students, which means in one classroom, I will put all the high ability students, the ones that are performing high, and in the other one, the low ability students, the one with the lowest performance. And the reasons why you want to do that is because in that way, the teacher can actually match the learning skills of the students and provide a better learning experience. So that's kind of like some arguments in favor of tracking. But then it's also true that people say like maybe there is this peer effect where students low achieving students also benefit for interacting with high ability students. So they actually get this knowledge because it's this peer effect. And so in that way, tracking the students will just increase the inequality between these two groups. And so this was very controversial issues. And so what Banerjee and Duflo did, working with again, one of the NGO in Kenya, they added 2 experimental variations. So at that time, there was a program that gave school committees funds to hire an extra contract teacher to reduce the first grade class size. So there was this program, which was willing to give the money to reduce the class size. But then taking benefit or advantage of this situation, they implement these experiments when in one, they track the students and the other one is not tracked, and this is done randomly. And so they actually were able to study what is the impact of class size, because at the end, they have some schools where there was no reduction in the class size, so they would just remain the same way they were. And then they have another one where they track the students, and the other one where they were not tracked, it's just randomly mixed. So they were able to make all these comparisons, and so they were able to really understand what is the impact of class size reduction, what is the impact of contract teachers working under some kind of incentive scheme versus these tenure civil servants teachers. So this dynamic incentive scheme is kind of, if you are performing well, if your students are doing well, you keep working here. Otherwise, you will leave. As opposed with some tenure faculty, which is independent of their performance, it's always going to be working. So that's kind of a very interesting question. They were also able to study the impact of giving power to these school committees, because at the end, the money was given, the funds, these funds were through these school committees. And then finally, the impact of tracking by achievement in primary school. So let me mention some of the findings. And again, at that time, a lot of researchers have there is evidence, but there was little evidence and sometimes not convincing on what is the effect of class size. So in students, what they show is that students assigned to stay with a class taught by a civil servant teacher did not raise their test scores, despite the class being cut in half from 82 to 44 students on average. So the class reduction didn't really do anything. And this is to the regular setting when you have some tenure civil servant teacher, there is no effect. Then in the students that were assigned to hire this contract teacher, and this contract teacher is this kind of more not tenure, but just kind of on a regular basis. So this actually had lower absence rate. So that's one of the key issues that we're going to see later. One of the issues is the absenteeism, but they have lower absence rate, but they also raised the test score significantly. So the students actually improved their learning and measured by the test scores. And finally, schools which track the student had actually an overall increase in the test scores. Was kind of some increase, kind of meaning that actually what it dominates is that the professor is now teaching at the level, and that really helped kind of to improve the learning outcomes of the students. Let me now talk about another very important results, and these are, at that time, these were new results, but now these are very famous. These are kind of, we'll say, classical results, classical experiments. All these, the ones that I'm covering, they are really their contribution and the classical experiments that now we see when we try to implement something new. So the next one is related to teacher absenteeism. So normally, poor learning outcomes, maybe you actually, and that's what people were thinking, well, there is a very high absence rate among teachers, and just because they lack, they don't have really the incentives, or they lack the strong incentives to attend to work. And so that was kind of at the time, there was kind of few studies really trying to address this issue. So there was little known about whether if you reduce this, teacher absenteeism will have some important impact on educational outcomes. And so they Banerjee and Duflo, and along with some other co-authors, they designed a field experiment in India, started in 2003, where they actually look at these incentives and how teacher responds to incentives that will benefit him. So they work with this NGO that runs informal schools to help students, that actually helps students not reached by the usual government school. Each of these schools has one teacher, and it actually has around 20 students, and they are just really covering language like Hindi and math. So what they did is the experiments, they randomly select some schools where teachers receive some kind of additional bonus per day attended versus the control group where you have just the regular, there's no incentive there. So the way it works really was the control group is, the teacher is going to still be paid the same. There is no difference. You're going to be paid monthly the same amount. But then in this treatment group, this randomly selected group of teachers, they were actually told, if you don't go the whole month, we're going to pay you half of your salary. But let's say you go the whole month, the whole 21 days of classes, we're going to pay you 1.5 times more. So if you really go, you're going to get more money. So this was really reflected. If you go, you get more money. And so this some very interesting feature was how to really measure that because these are rural communities in which students, teachers, they need to walk a long time to reach the school. So it's how really to monitor and to be sure that the teachers are going. So they actually give cameras to the teachers, and they were instructed to take a picture with students at the beginning and at the end of each school days. And that's how they were paid. At the end is based on these records. It's going to be the money that we're going to pay. And something very interesting was that teacher absence dropped by half in the treatment schools relative to the control schools. And so because of this one, student learning really improved. So this is actually some kind of intervention that turns out that is very effective in increasing student outcomes. But now one of the issues that start to arise, there was a similar study, but instead of being in the educational area, it was actually a financial incentive for nurses' attendance in government clinics. And this actually provides some cautionary note in the sense that they provide some incentives, but then in that intervention, in that experiment, the nurses were able actually to kind of like work through the program and actually all the absence be excuse absence. So they were really able to kind of trick the rules of the program. And so that's kind of like, even with the incentives, they were still able to manipulate the way this attendance was registered. So this is kind of an issue because saying like, okay, it seems like giving incentives linked to your attendance will work. But once they try in this other setting, it seems like it doesn't really work. So this actually raised questions whether this incentives program can be scaled up, because in one, there was an NGO, it was a small scale, an NGO implementing and monitoring this experiment. On the other hand, there was a government program that was scaled up, and government monitoring this program was not the best. So these start to raise issues on okay, you are doing experiments, we're getting some very interesting answers and policies, but once we apply these to other settings, are we really going to get the same effect? So this is the questions that start to arise, and I'm going to talk more about that later. Let me just talk very briefly some other contributions about health. A lot of the contributions are done on education, but there is also some other contributions in terms of health. So despite modern public health technologies such as vaccine, antibiotics, anti-malaria drugs, and all these have really improved the levels of health levels in even low-income countries. But there is still the risk of child dying before age 5 is still like 15 times higher in low-income countries than in high-income countries. And so the issue is like, okay, there's still like a very important questions related to health. So the study, and something that Kramer, and this is a contribution by Michael Kramer, is that these studies that randomize this disease control, for example, I will randomly assign some students to receive some vaccine and then some other students to not receive the vaccine. They don't really account for the true effect of the program because there is something that they call this positive externality. This is some positive spillover effect in the sense that, well, maybe I don't receive the vaccine, but if everybody else in my community receives the vaccine, well, then I'm also getting this benefit. So this is a positive externality. And so their approach were actually showing that all these experiments, they don't really capture this externality. So they really designed a study in 2004 to measure directly these positive externalities. And again, they partnered with some NGO, and they actually work on this school-based mass treatment program, which actually treats students with deworming drugs. And they actually saw very large effects on the infection rates. And they actually, because these infection rates of health improve, also school participation increase. But they also saw that there is an spillover effect in the area. It's not just the students that receive the vaccine that attend to this school, but also students, in this case, in about 2 miles, they also received, although they didn't really receive the vaccine directly, they see a positive spillover effect. And this is part of the contributions in terms of health. I will talk about one more contribution. Another very important policy question is whether and how much to charge users for health products or health services. And so the issue is that if there is a fee, this fee could actually reduce the uptake of some highly cost-effective products. For example, some vaccinations are just very, very cheap, but if you put some price to that one, that actually gonna stop poor people to access to healthcare. And so Michael Kramer and co-authors, they actually make an experimental assessment of how prices affect the adoption of health products in low-income settings. So they randomly selected 25 out of 50 schools in this deworming program to participate in a cost-sharing program. So parents were supposed to pay a small part, some fee, to getting this treatment for the children. And the results, they really show that uptake was 75% in schools with free deworming pills. But once you start to add some fee, which was very, very small, still like very heavily subsidized, only 18% of the children will take this vaccine. And so that really shows that the demand for these products, although they are very effective, right? They are very good in preventing these diseases. It's just individuals are just very price sensitive to this. And so it's not that they don't know the benefits, but just the price really makes a difference. So that's something that this experiment, the results, the findings of this experiment showed this. And actually, the British government has actually cited this study and other study related to this in actually calling for the abolition of user fees for health products and services in poor countries. Because again, even if there is a small fee, this actually stops people to taking these treatments. Let me, there is also some things about quality of care, but I'm thinking that, how am I doing with the time?
Ken and John, that's up to you with time.
I think it would be good to have some questions and answers, and the examples I think are dramatic and broad. So I'd rather move to the Q&A now,
Sure.
so that we don't lose too many people.
Yeah. I thought, the examples is just a lot. It's just health quality. There is another example of microcredit, and just very briefly, there is these microfinance movements that won actually a Nobel Peace Prize. They show that this program doesn't really have an effect. So this is really the kind of contributions. And another contribution is just related to the design of experimenting, how to generalize these results. So they address that issue. And that's actually their contribution. So I'm kind of fast forwarding. So this is the last slide, just to show that all this empirical evidence really make a substantial change in the way we do research in economics, especially developing economics, and had actually an important impact in reducing global poverty.
Great.
So that's kind of like this figure just showed that publications in top journals just related to field experiments just have increased because that's what people are doing now. I mean, in development economics. And so I'm happy to take questions.
Okay, Gail Dewsbury, do you want to go ahead and ask your question? I see it in chat.
No, you can go ahead and ask it. I
Okay.
asked 2 questions. You can go and ask it, Julie.
Okay. Dr. Sandoval, do you mind if I stop sharing your screen?
Yeah, I will. Yeah, I'll stop sharing.
Okay, this is from Gail. Oh, I just covered it up. Let me get it back, I'm sorry. All right, it says, were the textbooks related to the culture of the country, and what was the literacy rate of the parents?
So yeah, the actual numbers, I don't have them in mind, but it's true. The textbooks were really primary elementary school textbook, and was just really just basic information about math and what people really think like, yeah, this is the textbook that you should be covering. But it's true that I think for like the vast majority of students, I mean, their parents were illiterate, so they were really the first time going into a classroom. So there is really, I mean, how to for them it's just challenging. They really need to start in a different set, not start with some textbook and start reading and doing math, when first you need to start to learn some other skills. You need to develop some other skills before like these textbooks, and that's why they were really in this setting very not useful in improving the outcomes.
Thank you.
Okay, Roy, do you want to ask yours, Roy Weiner, or do you want me to ask yours from chat?
He has to unmute yourself.
He's trying.
Maybe you need it.
There he goes.
Well, there were a couple of issues that I'm sorry. There were a couple of issues that I brought up, and I was wondering whether the variables that you tested within each of the community were dependent on the underlying socioeconomic status of that community, or would you consider them to be more generally applicable? Not you tested, but the investigators tested.
So they really take into account the context of the situation. But for example, some of these, and that's why people start to raise the question about this. I mean, this is a very specific locality in rural Kenya where you show that textbook doesn't work. Okay. But once I go to a different country, some other rural area, maybe it's going to have a different effect. So it's true that some of these questions really are more specific on the setting, but some of the results were really kind of enlightening in the sense that one of the results was about these incentives. That's really about human behavior that can really extrapolate like, okay, it's true. Individuals really react to monetary incentives in a very direct way. And that's something that can really generalize and talk more about human behavior in general. So there were a mix of things, but the Nobel laureates were always trying to, okay, we designed some policy that seems to be specific, but we really aim to generalize that and try to see what do we learn and what it works that we can implement in some other countries.
So do you have any idea what proportion of the average income is a tolerable fee for families to absorb in order to elevate the variables that you were that were being tested?
Yeah, I don't have a very specific answer to that, but and I think that will depend on the setting. But yeah, I guess some of the issues with the experiments, and that's also one of the critiques is, let's say I have this program, these experiments where I give you the vaccination for free, and the other one I'm just gonna charge you, I don't know, like 5% of your income, or I'm gonna put like $1 price tag to this. and then I'm capturing what is the effect of charging $1. But that doesn't really tell me what if I charge $2? What if I charge half a dollar instead? So the experiment doesn't really tell me how different treatments, how people will react to different treatments. Maybe is like if you scale from half a dollar to $1, the uptake rate will decline by half, but once you increase it another $0.50, that's gonna just drop to zero. So there might be some kind of returns that are just kind of expanding, and so that's something that experiment cannot tell, and that's one of the critiques to this approach is just like, yeah, you tell me what works, this treatment, but it's in this very specific setting, in this very specific treatment. And so the approach of the Nobel laureates was really to redesign the experiment. I mean, when they see something that didn't work, they redesign and then they implement another experiment. So many of these experiments took many years, and these were just working with this NGO, like we make the experiment, we see it doesn't work, we redesign, we test again, and so on and so on. But yeah, I don't have a concrete number for your question.
It looked like the communities you were working in, charging almost anything, it really had a detrimental effect on your outcome. Is that the message you took home?
Yeah. For me, sorry.
No, go on.
Yeah, to me, the message is really that this is also rural communities in very low income countries. For them, yeah, paying even a very small fee is just really kind of very price sensitive. So it's really advocating, especially for all these treatments that are just very, very cheap. Like these are very cost efficient ways to stop the spread of this malaria, all these preventable diseases really are just really, and that's something the laureates show. This is a very cost effective way, because instead, normally government will provide healthcare. Okay, you get sick, you go to the hospital, and then the government will provide these services in many of these countries. And so that's maybe I just really try to give you the vaccine and so prevent you to go that. So in that sense was also cost effective.
Yeah.
Okay, Izzy, go ahead.
In those, in the situations where the teachers didn't show up, did the students get a substitute? Were they combined with other classes? What happened in those situations?
Nothing. So that's the setting. This is the students will go, the teacher doesn't show up. I guess the students will wait 20 minutes, 1 hour. If he doesn't show up, we just go back home. So there is really no power. There is somebody enforcing this. And it's not because the government doesn't want, but it's just really, this is very remote places. So really kind of monitoring and looking that the teachers are going, they just really don't have the incentive. So in that cases, yeah, students were just, just not receiving the learning that they wanted.
Lynn, would you like to ask your question, or do you want me to read it from chat?
I can ask it. I'm somewhat familiar with the Prairie School experiments, and they were spearheaded by another Nobel laureate, James Heckman. So I'm curious to what extent, if at all, these class size experiments that Duflo and others did that were directly influenced by the earlier Prairie School projects, which also looked at student-teacher ratios.
Yeah, no, they were, this was actually, there was not only this experimental evidence from the Prairie School program in terms of class size. This was actually a policy question long before they actually tested in this setting. This was already a question. There was already work done by other researchers using more, not experiments, but using some kind of observational data and trying to assess the effect of this class size reduction. And some of them, they were showing some positive benefits. So there was already research done there, but there was nothing like an experimental, other than the Prairie School program, there was nothing else there to provide more solid evidence of the effect of this class size reduction. So yeah, definitely James Heckman, he's a very influential figure in empirical economics long before the Nobel laureates. And yeah, it's part of the research, but I think it's kind of, they are just trying to try more things, and that's kind of like the thing.
All right, John, do you want to go?
Yeah, I'm very interested in the potential application to problems in this country. One irony is that we have established our class size reductions in the Constitution of our state, and that may have been premature without much evidence. But I'm interested in a minimum guaranteed income. And can you see this kind of experiment applied, or has it been applied to that concept in America, where we have 10% or higher poverty level in this country?
Yeah, so that's a very interesting question. So in terms of having some kind of income, that there was never such a test like that. The things they were always testing was very concrete policies, like I will give you a textbook, I will give you this vaccination, I'm gonna give incentives. It's just very concrete, because the idea is like in that way I really control everything. And so I'm sure that what I found is the causal effect of this treatment, but I'm kind of like not letting external forces contaminate the experiment. So that's
Right.
one they were never really studied something like that. But in terms of kind of the effect of their research for high income countries, for more developed economies, although they focus on India and in rural kind of low income countries, a lot of the research now that is done for the US and for other countries really takes insights from them in the sense of the design of experiments. So now they're really more like also this experimental approach to kind of learn about this. One experiment that I have in mind is there was some experiment to study the effect of the weatherization assistance program in Michigan. And that's a program where the government gives some money for you to improve your energy efficiency by making some upgrades. So there was some kind of randomized experiment, a little more complex than the one they're doing. And they just show that the effects, there is energy efficiency will reduce your energy consumption. But the main result is, yeah, you're going to pay less in your utilities, but that's not enough to compensate the investment. It will take like 20 years to recover the investment when all this, when you get a new air conditioner, it's only have a life of 10 years. So this is, and that's a published paper, very recent and famous. And so this is really taking that approach to a different context,
Right.
but it's some very concrete results.
Well, it's very frustrating to see policy made ideologically by the left or the right without experimental evidence. And the idea that, for instance, I mean, we got this problem with cutting taxes will lift everybody up. That's one view on one side. Another is that public is better at running certain institutions like prisons than private, and this sort of thing. And it would be nice to base policy on solid evidence. And so I'm looking at this approach of experimental economics as a way of cutting through all the ideology of the left and the right and come down to pragmatic things that work. But I'm not sure it's ready for prime time yet.
Mark John is an optimist.
I am. Well, this is a fascinating talk. It would be nice to see its application used. I was amused at Kenya, in which one of the most effective thing is teaching to the test, which is what we unfortunately do in a lot of American education. But it's a kind of a circular argument. They'll do well in the test if you teach to the test. And I'm not sure that gives us all that much insight in how to actually educate people.
Well, it all depends on whether you want them to be able to use the information productively.
Right. hard to test for that in some ways too. Yeah.
Eli, did you want to ask your question real quick?
Sure. Just a very quick one. Do the experiments coordinate with the UN Development Organization or the OECD?
So at the beginning, they were actually done by these NGOs. These are non-governmental organizations in Kenya, in rural India. There were already these organizations that they partnered with the with the Nobel laureates. But later on, once they actually start to produce results that people start to see, oh, we thought textbooks will work, but now you show it doesn't. So it's kind of try to draw attention on this one. Actually, the World Bank, which is part of the United Nations, they give money. I think the OECD, I don't know if they fund any study, but yeah, United Nations and other organizations have actually put money on this Poverty Action Lab and many other centers to kind of try this experimental approach. And I just cover some of the classic ones, but now there is hundreds of experiments done by many people in many things.
Well, one would hope that there is an overarching world effort to at least understand everything that's being done so they can produce some reports annually, at least, in which direction we ought to be going.
Yeah. I mean, there is, I will say that there is effort for many places, but there is no one central place that is really coordinating. But yeah, the Poverty Action Lab, they carry a lot of these experiments, so they really have a very, their website will really show we did this is what it works. They are really trying to compile the evidence and also kind of adding experiments done by other researchers. But yeah, I will say there is no really one place where you will find this is the place where I can see everything. No, that's something that is missing, because at the end it's just a lot of knowledge already produced, but it's kind of like now you need to disseminate.
So John, with relation to your question, I think over 20% of the US population at the moment is living under poverty conditions. And it may be considerably higher under the specifics of where we are now until we get some more money out there. If there are no other questions, I'd really like to thank Professor
Yeah, it was excellent talk.
Sandoval for a terrific talk. You really did a great job of elucidating what this prize was about. There's a lot of our Nobel talks where we don't quite achieve that in all these different fields because of the technicalities. So I think you really did a great job, and we've had feedback already of people who are highly appreciative. So thanks again.
Great. Yep, thanks.
Thank you. My pleasure, really. Thank you.
And next week we have the Nobel Peace Prize. This week